Hi, I'm Dr. Nitish Krashian, and I want to talk to you about why patients fail with preventive and alternative medicine that suffer from autoimmunity. And really, the main reason is because the practitioners that are treating them don't really understand autoimmunity. And they simplify autoimmunity as just being leaky gut, and they simplify autoimmunity as just being heavy metal toxicity, or they think it's just some random infection. And they then put a patient on one supplement after another supplement, and then they try to do chelation with them, and they really totally miss the whole clinical game. So the clinical game that's effective with autoimmune disease management is first to figure out which autoantibodies are involved, where the target proteins are, and what part of the immune system is dysfunctioning. It's not all about leaky gut. You can have dysregulation in T cells and B cells and regulatory B cells, regulatory T cells. You can have chemical binding to different target proteins. You can have dendritic overactivation. Yeah, you may have intestinal permeability. You may have a combination of these events. There's a whole list of things that are actually involved with autoimmune disease management. And a simple model of just having an autoimmune protocol or just having every person that's autoimmunity just assume that their gut's dysfunctional and have that treated, or assume they have chemical overload, is a failing model. So one of the things that we're going to talk about and teach in the Krashian Institute autoimmune disease course is we're going to go into how to properly work up the autoimmune disease patient, but also how different autoimmune disease mechanisms work. So you cannot be protocol based when it comes to autoimmunity. You have to really get in there and look at all these different types of mechanisms. And then as a clinician that's in the preventive medicine model, you have to realize what's realistic with prognosis. So it's so critical that you don't just give them protocol, but you teach them how to recover from a flare-up and what remission is, and for the patient to understand their prognosis and how all these things work. At the end of the day, it's a non-curable disease, and what we can do in alternative medicine and diet, nutrition, lifestyle model is to help them be in a remission state for as long as possible, and then also help them recover as soon as they can when they get a flare-up. So these are the key things that are important to us, and this is one of the reasons why I think many healthcare practitioners fail when they work with autoimmune disease. They really think if they just get their chemical load down that their autoimmune disease is going to go away, or if they just fix their leaky gut that their autoimmune disease is going to go away. And if that's the clinical mindset, it's 100% guaranteed for clinical failure. So anyways, hope you can join me in the Krashian Institute autoimmune course, and we'll be going over all these different important clinical concepts and treatment applications. Thank you for your attention.